my town, structures are mainly constructed with masonry work. During my contacts of painting interiors, one problem that I'm just not able to solve properly is that of dampness rising in the walls from the ground. I've tried several products and their combinations, but I find that the problem reappears in no time at all, leading to blisters and peeling of paint. All the painters in my town call this problem a cancer of the walls. Do you have any solution for this cancer?
Oscar, rising dampness really is a cancer of the walls and is one of the most difficult problems to solve. The dampness not only leads to spoiled interiors but also a musty smell in the house and growth of bacteria and mold, leading to respiratory infections and even asthma. Let me explain how rising dampness is caused. Brick walls have fine and large capillaries running through them. Due to higher groundwater table or in monsoons, the water enters these pores and rises in the wall due to capillary action. This water shows up through the plaster and POP, putty, etc. as rising dampness, causing peeling of paint and other problems. Now, this normally should not happen since an impenetrable barrier is provided at the plinth level, which, as you know, is called a damp-proof course. However, if this fails, then rising damp problems start. If the problem is severe, then the water can rise as high as 4 to 6 feet above floor level. There is now an excellent solution to your problem with Dr. Fix-It Dampfree. Dampfree is a siliconate-based injection grout with low viscosity and high penetration, specially formulated for rising dampness in brick walls. When Dampfree is injected into the damp walls, it flows into the capillaries in the walls. Here, it sets in the presence of water and blocks the capillaries in the bricks and plaster. Dampfree prevents moss and fungal growth. Therefore, it also prevents respiratory problems and asthma.
So, where all can we apply Dampfree?
Dampfree is very effective for brickwork.
And how do we apply Dampfree?
Let's see the correct method of using Dr. Fix-It Dampfree. First, identify and mark the area for grouting and inserting of nozzles. For a single brick wall, the holes can be drilled on any one side of the wall. For a double brick wall, the holes could be drilled on both sides of the wall. Dampfree should be injected at the lowest possible point. The holes should be in 2 horizontal rows. The bottom row should be around 150 mm from the floor or ground level, while the second row is around 225 mm above it. The hole should be spaced around 150 mm center to center in a staggered manner between the 2 rows. Using a 12 to 15 mm diameter drill bit, drill holes at a downward angle of 45 degrees. The holes should be drilled till they cover from half to 3/4 of the thickness of the wall structure. Fix 12 to 15 mm diameter nozzles into the drill holes. Place the nozzles in such a way so as to leave sufficient gap at the inside end for inflow of the grouting liquid. Seal the nozzles using mortar modified with Dr. Fix-It Pedicrete URP or MPB and allow them to set for at least 24 hours. Depending on the severity of the dampness, Dr. Fix-It Dampfree is diluted. For severe problems, dilute in the ratio of 1 part Dampfree and 5 parts water. For mild problems, dilute using 1 part Dampfree to 10 parts of water. Inject the diluted Dr. Fix-It Dampfree into the first hole by pumping with a grouting pump that can create a pressure of up to 2 kg per square centimeter. If the liquid comes out from one of the lower holes, then stop pumping and seal the hole as we will explain shortly. If the liquid does not come out, then pump till a back pressure is felt. Let the Dampfree set in that hole for an hour while you work at some distance away from this area. After an hour, again inject Dampfree into the same hole till the liquid comes out of a nearby hole or till a back pressure is felt. Now move to the adjacent nozzle and repeat the process. To seal the holes, remove the protruding nozzles. Seal the holes with a suitable grouting compound. Let us see some of the important precautions to be taken while using Dr. Fix-It Dampfree. Ensure that you inject sufficient quantity of Dampfree into the walls till it comes out of the hole below or till a back pressure is felt. Dilute Dampfree according to the severity of the dampness.
You have explained the process of injecting Dampfree on an outer wall. What if the dampness is in an internal wall?
Well, Oscar, for inside walls also, the treatment is exactly the same.
Sir, tell me, is it necessary to remove the plaster on the brick surface before grouting?
No, it's not essential. In fact, this is the advantage of using Dampfree.
Tell me, is Dampfree suitable for grouting on stone masonry walls or concrete?
No, Dampfree is only meant for brick masonry.
After the grouting, how long will the surface take to dry?
Well, depending on the atmospheric conditions and the severity of dampness, it may take 4 to 10 weeks to dry.
And how long does the Dampfree treatment last?
Oscar, if properly applied, Dampfree is a permanent solution for persistent problems.
Thank you very much, sir. I'm sure that all my other contractor friends will find Dampfree very useful in solving rising damp problems.
Well, Oscar, you're most welcome.
Thank you.
If you also want to cure rising dampness, the cancer of the walls, then always use Dr. Fix-It Dampfree, the best solution for problems of rising dampness in walls.